Good evening, viewers. Myself, Dr. Rajesham. I have completed my MD and my PhD. I'm a PhD scholar. I'm assistant professor of psychiatry at Enepoya Medical College. So today, in this evening, I'm going to present to you on a topic called anxiety disorders. So let's learn about anxiety disorders. Please start my slides. Good evening, friends. Myself, Dr. Rajesham. We'll start this presentation now. Let me introduce this topic to you. We all have some of the friends who, when get into trouble, start telling, I overthink. They keep telling, oh my God, my overthinking troubles me. Because of overthinking, they land up in troubles and that causes lot of stress and trouble to them. We suffer more often in imagination than in reality. This excessive imagination or overthinking lands us in trouble. You know, the depressed individual who is sad usually tells, I want to die. But an anxious individual who is in lot of stress tells, but what if I die? Usually they are troubled with what is going to happen in future. Next slide, please. Now, all we all have this question: what is the difference between normal fear and anxiety? We all have fear. When we land up in a trouble, we have something called an emotion called fear. This emotion called fear is actually protective to us. Let me explain you with an example. When we encounter a rabid dog, a violent dog about to bite us, when this dog is about to bite us, we all face an emotion called fear. What is this? This is a protective mechanism. This emotion called fear usually evokes the sympathetic nervous system in our body, and this fear protects us and makes us run away from the dog. So it is protective. Now, how is it different from the anxiety? Let me explain. Fear refers to the brain state associated with presentation of overtly dangerous stimuli. It is an acute, immediate manifestation on abrupt encounter with highly salient threat. So when we encounter a dangerous stimuli, we produce in our mind an emotion called fear, and we tend to get away from it and protect ourselves. Now, how is it different from anxiety? It is a brain state elicited by signals that predict impending but not immediate presentation of danger or threat. Anxiety is a sustained change in the brain manifest when threat is relatively removed from the organism. So, our fear, which we call I felt anxious when we are exposed to a threat, is different from what is called as anxiety disorders. Let us see the differences between the two. This fear is an emotion which is produced by a known, external, definite, non-conflictual threat which is temporary. So I already explained to you. There is a dog about to bite you, and you get an emotion called fear, and the dog is present in front of you right now. On a temporal perspective, it is a response to sudden appearing immediate danger. On a spatial perspective, it is an acute response to proximal threat. But what is anxiety disorder? It is an emotion caused by unknown, immediate, vague, conflictual threat, and it is often long lasting, which is very stressful to the person. On a temporal perspective, it is a sustained, insidious response to danger, and here the threat is ambiguous. On a spatial perspective, it is a response to distal or future threat. So, in fear, or what normal people call normal anxiety, it is a fear evoked by something that is present right now in front of you and causing something called threat in the individual. But anxiety, the person is usually bothered about something that can happen in the future, and he is worried that often a bad thing is going to happen in future, and this what if bad thing happen, this kind of thought evokes an emotion in us called anxiety and creates lot of stress to the individual. Let us know now first about a common anxiety disorder called panic disorder. Panic disorder is a type of anxiety disorder very commonly seen in the society. Let's see what it is. It is a recurrent, unexpected panic attack. What is a panic attack? It is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes and during which time at least four of these symptoms occur. Which are the symptoms? Palpitations. There will be increased heart rate and feeling of heart rate. There will be sweating, trembling, breathlessness, chest pain or discomfort, nausea or abdominal discomfort. There will be chills and heat sensation on the head and different parts of the body. There will be something called derealization or depersonalization. Occasionally, the person can feel dizzy, unsteady, lightheadedness, or feeling of falling aside, fainting kind of feelings, and feeling of losing control over one's own mind. And sometimes patient has even fear of dying. This is called panic disorder. I will explain to you how a panic episode or panic attack feels like. The attack often begins with the 10-minute period of rapidly increasing symptoms. The major mental symptoms are extreme fear and a sense of impending death or doom. It is very, very stressful to the individual. Patient usually cannot name the source of their fear. They may feel confused and have trouble concentrating. The physical signs often include tachycardia, palpitation, dyspnea, and sweating. Patients often try to leave whatever situation they are in to seek help to come out of this situation. The attack generally lasts about 20 to 30 minutes and rarely more than an hour. Sometimes even it can be 2 to 3 minutes also. It lasts from this to an extreme up to 1 hour. A formal mental status examination during a panic attack reveals rumination, difficulty in speaking. Usually, they'll be choking, threatened, and impaired memory. Patients may experience depression or depersonalization even during the attack. So, this is how a panic attack looks like. So, the person here does not know why he is having such intense fear and will be suffering from it. Panic disorder has a prevalence of about 4% among the people. Up to 4 people among 100 can have panic disorder. Women are about 2 to 3 times more affected than men. There will be comorbid depression in some of the people. Why does this panic attack happen? There is an abnormal regulation of brain noradrenergic system. There are many problems in the brain in these people which leads to the occurrence of panic attack. There is increased sympathetic tone. There are abnormalities in neurotransmitters like norepinephrine, serotonin, and GABA. Some of the panicogens are substances which can precipitate a panic attack. Some of them are like carbon dioxide, bicarbonate, and sodium lactate. These are the substances when person is exposed to it have higher chances of getting panic attack. On brain imaging, what we call CT, MRI scan, etc., show abnormality in hippocampus, amygdala, and cortical atrophy. The normal scans may not reveal these problems, but specialized scientific scans can reveal these findings. First degree relatives have 4 to 8 fold higher chance of getting a panic attack. So, if a person in the family has panic attacks, the chances of his relatives having panic attack is about 4 times or 8 times. Now let me explain to you how a panic attack happens. Usually, person starts getting all these anxiety symptoms after an exposure to stressful situation. There will be some kind of environmental significant stress which can precipitate getting a panic attack. There can be even some physical conditions which can predispose a person to get panic attack, but we have to investigate and find what it is. Okay, let's see a psychological way of getting it. If the person is in stress, he will be usually worried and fear builds up in his mind. Or because of this fear, subconsciously, he misinterprets the physical cues as real threat. So when you are worried, you tend to have some physical changes or physical symptoms, and the person starts subconsciously misinterpreting these sensations as some real danger. This misinterpretation makes him pay more attention to these physical sensations. Because of this, automatically body starts releasing hormones like adrenaline to prepare for a fight or flight response. That's called something like you running away from the dog. And you only focus your physical sense on your physical sensations and you ignore the actual fact that There is no real danger around you. Because of this, a catastrophic misinterpretation of your own sensation, you think that there is a real danger in your body. What if kind of thoughts make you get a panic attack? This panic attack further predisposes you to get further panic attacks, and you cannot calm yourself down anymore. You think that you will faint and get crazy because of these panic attacks, and a full blown panic attack or panic disorder happens. This is the vicious cycle which I have just now explained to you. A triggering stimulus will be there, an internal or external, because of which physical sensations like palpitations happen because of the stress. There is something called perceived threat. There is something wrong with your body, kind of thought happens, and an anxious arousal will be there. Because of this abnormal thinking style, anxious arousal happens in the body because of sympathetic arousal. Then sensations happen, something like strong palpitations, sweating, or heat flashes. All these are happening normally. These are the normal changes in the body due to the stress. These produce a catastrophic misinterpretation in your mind, or a thinking as if, what if something bad is going to happen to my body? This abnormal thinking style, see here it is written as something really bad is happening. I could be having a heart attack. This is the thought that can come to your head. This kind of thinking style makes you get a panic attack. So one panic attack happens, this increases the thought that something bad will happen in future, and more panic attacks happen, producing a patient of panic disorder. Okay. Now treatment part I'll explain to you later. Now next type of anxiety disorder is phobia. What is phobia? It's a marked fear or anxiety about a specific situation or object. Here the person is more worried about objects or situations. Some examples are like fear of flying in an aeroplane, fear of high places, fear of animals, fear of birds, receiving an injection, fear of seeing blood, etc. The phobic object or situation always provokes this kind of immediate fear or anxiety in the person. So the person actively tries to avoid these objects in order to avoid getting further phobic attacks. But this avoidance behavior increases the chances of that person getting further phobic attacks. The fear, anxiety, or avoidance causes clinically significant distress or impairment in his social occupational function. If this problem in his functioning or life is there, then we are supposed to treat the phobia. These are some of the examples. Fear of cats is called ailurophobia. There can be fear of spiders or many of these animals and situations. Coming to common epidemiology, the lifetime prevalence of this phobia is up to 10%. Women again have higher chances of getting it. Peak onset of blood injection type phobia is 5 to 9 years, where suddenly your BP drops and you fall off. Specific phobias have bimodal age of onset. Another type of anxiety is social anxiety disorder or social phobia. It is a marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. Some examples are like having a conversation with your friend, meeting unfamiliar persons. So, in social anxiety disorder or social phobia, the person will be worried about how he will be judged by other person in the society. So, he will be having fear of exposing himself to general people. The individual fears that he or she will act in a way or show anxiety symptoms that will be negatively evaluated by others. So he will be worried that he will be negatively evaluated by other people, and because of that, he will be having fear of exposing himself to the social situations. So he thinks that he will be humiliating or embarrassing himself. This will lead to rejection or offend by others. Social situations always evokes fear in him, and this causes problems in his life. Then it has to be treated. Again, 3 to 13% chances of this person getting social anxiety. Females again have more chances than males. Teenagers have higher chances of getting these illnesses, but as age progresses, the chances reduce. And they will have behavioral inhibition. They tend to stay homes rather than going to public places. Stage fear will be there. First degree relatives have higher chances of getting it. The most common type of anxiety that we see is next type called generalized anxiety disorder. In generalized anxiety disorder, there will be a broad set of symptoms. There is excessive anxiety or fear and worry occurring more days than not for at least 6 months. Individual has difficulty to control his worry. The most common type of fear that is there in the patient's head here is worry, continuous worry about what bad is going to happen to me in future. It is a very broad set of categories rather than phobia where fear is there for particular object. Here, broad set of worry will be there. The symptoms are like restlessness or feeling keyed up on an edge. That is, patient will be usually restless and worried every day. He is always fatigued. There will be some amount of sleep disturbance in the person. Difficulty in concentrating in the work will be there. So this is the person who will come to you and tell, I overthink, I am having problem. There will be irritability, who will be always frustrated. There will be some muscle tension in the body and sleep disturbance. These are the set of symptoms. At least three are there among this that we can call him as symptom person with generalized anxiety. 1 year prevalence is 3 to 8% in general public. Women have higher chance of getting it. Usual onset is during adolescence or early adult. It often exists with other anxiety disorders, but in other panic, I told you it's an episodic pattern. But here, whole day the person is anxious. This again happens because of problems in the brain. The problems are in basal ganglia, limbic system, and frontal cortex in the brain, which are abnormal, which has to be treated. The neurotransmitters or chemicals in the brain like serotonin, cholecystokinin, norepinephrine are in abnormal concentration. There will also be problem in the hypothalamo-pituitary adrenal (HPA) axis, and relatives have higher chances of getting it. Okay, now what are the treatment for this anxiety? There's some problem with the slides here. That's okay. Now, treatment for anxiety are given in various areas. The common type of treatment that is offered is one, relaxation technique. Starts with psychological treatment like relaxation technique, diaphragmatic breathing. Some behavior therapies are needed in some conditions. Psychoeducation is done or explained about the anxiety disorder. Next, cognitive restructuring is done where the abnormal thinking patterns are corrected. Then the treatment has to be done with drugs or tablets called pharmacotherapy. Okay, now let me first explain how counseling is done with cognitive behavior therapy. What you do here is you have to treat the cognitive distortions in the patient. Cognitive distortions are abnormal thinking patterns that the patient has, which can precipitate him getting further anxiety. Most common cognitive distortion in anxiety patients are catastrophic thinking or catastrophization and fortune telling. What is catastrophization? An anxiety person often predicts or says that bad thing is going to happen. For example, if a person is about to ride a bike and he has anxiety, he will start fearing that he might fall down when he drives the bike. What is catastrophization? Thinking that he will definitely fall. There are higher chances of him getting driving the bike well, but he still thinks I might fall, I may fall. If a person has fear of cats, the cat is very chill, cool, but he still fears that cat might come and chase him. This is called catastrophic thinking. What is fortune telling? Fortune telling is predicting that bad things might happen. The dog might be sleeping there in his cage, but this person still thinks that dog might come and chase him. This is predicting a few bad thing happening in the future in spite of not knowing what is going to happen in future. This is called predictive thinking. These are abnormal thinking styles that has to be corrected in these people. Now, in phobia, what do you do? Phobia is mainly fear of certain situations or certain animals or objects. Here, behavior therapy works where systematic desensitization is done. Here, you have to expose the person systematically in a graded, slow manner to the objects of fear. If a person has fear of dogs, you should slowly expose him to the fearful object in a phasic manner slowly and reduce the fear by deconditioning. This is what is done. There can be imaginal flooding, which is not done usually, flooding. Here the person is suddenly exposed to the fearful object or situation. The person will get fear, but slowly he will calm down. Hypnosis and other psychotherapies can help along with pharmacotherapy. What is pharmacotherapy? Here, tablets are given for treatment. It is psychiatrist area where benzodiazepines, SSRIs, SNRIs, buspirone, etiozolam, multiple tablets are available with which we treat the patient. SSRIs is the most prescribed antidepressant or anti-anxiety tablet. SSRIs increase the level of neurotransmitter called serotonin in certain areas of the brain, and because of which anxiety can be treated and reduced or maintained well. Citalopram, fluoxetine, and many other antidepressants or anti-anxiety tablets are available, which help in treatment of these patients. In generalized anxiety, when there is acute crisis of severe anxiety, we normally treat it with benzodiazepines for a very short time. That is, should be given for very short time of 2 to 3 weeks. Then it should be stopped. Then main anti-anxiety tablets, that is the first line drugs like SSRIs, SNRI, pregabalin, and second line drugs like agomelatine, beta blockers, etc. can be used in order to manage these patients. Coming to panic attack, similar tablets can be used. Crisis management like benzodiazepines and first line drugs like SSRI, SNRI, venlafaxine. Second line drugs like mirtazapine, like muclobamide, and MAO inhibitors are used in order to treat the patient. Now coming to what you can do in your life, that is most important thing, that is called lifestyle changes. Lifestyle changes are play a very important role in the treatment of anxiety. Remember, the most important thing is maintaining a healthy lifestyle. A good night's sleep is the most important thing. If you people are working in a very stressful, hectic situation, it's important for you to have a good night's sleep of about 7 to 8 hours per night. It should be a quality sleep. Do not keep your lights on. Sound sleep should be available. Maintain a good sleep routine. Do not put your earphones and sleep in the night. Do not have a cup of tea in the night and sleep. Have a good night's sleep in a silent room, because of which your anxiety can be cured as well as prevented. Next, coming to regular exercise. A regular exercise regimen of about half an hour to 1 hour per day should be done regularly in if you are up to a sedentary lifestyle. Then laugh a lot, develop hobbies which can distract your mind from a stressful work style, that can provide you a lot of relaxation. Maintain healthy diet. Do not go into lot of carbs, a lot of fat, etc. Maintain a well balanced diet in your life, because of which your good health and a calm mind can be maintained. Maintain a good work environment which is very peaceful rather than working in a stressful lifestyle. Maintain a good interpersonal relationship at home rather than involving in lot of conflicts with your friends, relatives, or whoever, and maintain a peaceful interpersonal relationship in and around you. Avoid illicit drug abuse, which is very important. Involving in drug abuse like cannabis, cocaine, MDMA, LSD, and even excessive use of alcohol, tobacco, or cigarette can ruin your life like anything. So please, please, please avoid use of illicit drugs in order to reduce your anxiety. We have seen people who think that usage of illicit drugs can reduce or manage your anxiety attack, which is absolutely wrong. So kindly do not involving in these illegal substances. Better to ask for professional help. We doctors, psychiatrists, and psychologists are readily there to help you. Better consult us in case of severe panic attack or anxiety disorders. We can provide you good help, professional help, and because of which you can lead a happy lifestyle. These are some of the references. Please see, you can go to your YouTube and see these videos. It has taught some progressive relaxation techniques or guided imagery. It can help you to manage a good, less stressful environment. But once a disease happens, it's important to consult a doctor. Thank you from my side. Have a nice day. Bye.